Hi, my name is Letitia Roden, and this is my Xtreme Makeover presentation for NU 713, Organization and System Leadership for Advanced Practice Nursing. The purpose of this presentation is to reflect on a time where miscommunication occurred in the workplace and determine what barriers led to this miscommunication. Describe how organizations' conversations lead to organizational culture. Learn how to communicate in an organization setting. Learn the difference between mechanistic and conversational leadership. Identify the importance of innovation approaches to crucial conversations as they relate to ways of talking, ways of listening, and mindfulness in an organization relationship. By the end of this presentation, the audience will be able to describe barriers which facilitate organizational and individual miscommunication patterns, understand ways that leaders can support effective communication and problem solving within a complex healthcare organization, identify the difference between mechanistic and conversational leadership, explain the importance of innovative approaches to crucial conversation and ways of talking, ways of listening, and mindfulness in an organization relationship, and reflect on how leaders can use our words to leverage relational practices and by identifying ways of moving toward a conversational style leadership. Reflecting on miscommunication in a workplace, a long-term care facility that previously relied on paper medication administration records and charting for many years switched over to electronic medical records. The electronic medical record system had to be learned by all nursing staff caring for patients in the facility. Although there was a policy in place around high-risk medications such as Coumadin, such policies were not revised to reflect the changes as it applied to entering orders in the electronic medication administration system, almost resulting in a critical medication error. The physician order stated, "Give Coumadin 7 milligrams daily." When entering the order in the computer, the nurse marked the interval code as daily, which was correct, but on the time code she chose the 9 a.m., 1 p.m., and 5 p.m. as the time administration for the medication, which would have made the Coumadin due 3 times daily rather than once daily. The nurses who transcribed the orders were disciplined for not following facility protocol and for transcribing the order incorrectly. So how did this miscommunication occur? By failure of the nurse to focus on entering the order correctly, failure to change the policy as it related to the new computer system program, failure to communicate a sensitivity in the electronic medical record system, and a breakdown in communication, by failure to abide by systems in place to prevent errors by the oncoming nurse, failure to accurately document medication changes, and failure to update the communicate high-risk medication policy. Conversational themes. By reflecting back on previous conversations with coworkers, there seem to be several conversational themes alike: mandatory extra shifts for nursing, staff shortages, unfair distribution of work duties, and lack of salary employee raises, which left a culture of workers feeling overworked, feelings of not having enough time to do a good job, lack of employees' morale, and feelings of unappreciation, and left many employees searching for new employment opportunities. Organizations as communication. Organization communication is how organizations denote themselves, present and establish their organization climate and culture, along with the attitudes, values, and goals that describes the organization and its members. Organization communication mainly concentrate on building relationships and interaction with in-house organization members and concerned external communities. Organizations and conversations are formed by patterns of meaning and patterns of relating. Patterns of meaning represent specific themes such as the company's vision. With this particular facility, the vision clearly states we exist to enhance the lives of those we serve, and above all, we will keep our patients first. Enhancing the lives of those we serve and keeping our patients first would mean correcting the staff shortage to provide adequate care to our patients, fairly distributing duties, extra shifts, and workloads among all nursing staff. Patterns are relating, how we communicate, how people work together and communicate with each other from an organizational culture such as email conversations versus face-to-face communication, seating arrangements that flex superiority, related to how managers relates to other members of the team, which could encourage lack of employee morale and feelings of unappreciation. Relational leadership. Relational leadership involves relational methods of people organized together trying to accomplish and make changes to benefit the common good. This leadership empowers others to become active participants as a team. So relational leaderships involve the entire team to set driven values and standards and consider others with different points of view and to try to form a common purpose. Ways of talking, our ways of speaking in organizations are patterns that can reinforce and stabilize culture. The divergence, by being aware of our words and selecting language purposely, we can firmly preserve themes that are powerful and useful to us, or we can take up new language and new ways of speaking with others that are more dependable and meaningful. Language helps us form and can change meaning. Ways of listening. Listening, joining in a conversation, and largely paying attention, of course, is a significant aspect of this combined communication. To offer our response, we must be in harmony with gestures that other people are making, and also we must be aware of the gestures we're making to convey listening. Mindfulness, the energy of being aware and awake at the present moment. To be mindful is to be in existence and as one with those around you with what you are doing. Developing a mindful practice is an excellent opportunity to encourage the ability to participate and contribute to organizations as a conversation. Mechanistic leadership. This particular structure is a leadership style that was used, that's been in practice for a while. The mechanistic structure is characterized by limited extent of control. The mechanistic structure is central with power preserved at the top of the organization. They typically have a high degree of reinforcement with lots of standardizations, rules, and procedures. Decision making is dispersed down into the organization and leaves no room for team discussion. Conversational leadership, which is the direction that we want to move toward, refers to all processes a company uses to communicate information across the organization rather than just from top to bottom. In creating a trusting culture in which communication roles become something that's more and more bear the resemblance of two friends talking. So innovation. Innovation is the occurrence of depleting structures of meaning and that a certain level is required of innovation to occur. Different ways of talking and new patterns of related can lead to misunderstanding. In the ensuing conversations, people probe and question each other to attempt to stabilize meaning and understanding. In this process, new meaning may emerge that become a new pattern. Recognizes the more the managers can make a decision. So with changing the story, Ways of changing the story is forming a transparent workplace. By withholding information within an organization, managers often create a lack of confidence from employees that can quickly turn to distrust. The best way to prevent this is to practice open, transparent communication. Instead of using I, we should use we and us to demonstrate inclusion of the entire team. Establish agreed upon objectives, missions, and core values as a team. Encourage participation by asking questions and listening. So with changing the story, a long-term care facility that previously relied on paper medication administration records and charting for many years switched over to electronic medical records. The electronic medical record system had to be learned by every employee caring for patients in this facility. Although there was a policy in place around high-risk medications such as Coumadin, a near-miss medication error was nearly made. The physician order stated give 7 milligrams of Coumadin daily. When entering the order in the computer, the nurse marked the interval code as daily, which was correct. But on the time code, she chose a 9 a.m., 1 p.m., and 5 p.m. as the time to administer the medication, which would have made the Coumadin due 3 times daily rather than once daily. After collaborating with all nurses and staff around avoiding medication errors, the team would evaluate the current plan and make changes pertaining to new electronic medical programs. And this is an example of relational leadership. When speaking with the nurse who made the errors, using words like us and we assign ownership to the problem from the entire company and does not place the blame on one person. The nurse who transcribed the order was disciplined for not following the facility protocols and for transcribing the order incorrectly. Ways of talking. Giving the nurse as well as the team an opportunity to express their views of what might have happened and solutions to fix the problem. Open up channels for effective communication and processing improvement. Ways of listening. Being aware of the whole situation, such as the sensitivity of a new computer system and safety tools that can be added to help implement better policies, improve staff education, and reduce the risk of errors, thus improving patient care and satisfaction, is the example of mindfulness. As stated before, changing the story, using relational leadership by collaborating with the entire team to form common goals, encourage participation, and encourage new practices established by the team based on moral standards and different points of view. Ways of talking, by becoming aware of our words and selecting language purposely, we can form important themes while staying on track with those subjects that are useful to us. Ways of listening and joining in the conversation, paying attention along with being aware of our own body language as well as the body language of others is important, and being mindful.